Okay, today I'll be refuting the claim that weight loss surgeries are a harmful way to lose weight. My advocate's secondary claims were that 1, weight loss surgery is not necessarily the easy way out, and 2, that weight loss surgery patients still struggle after surgery. For this refutation, I'll be responding strictly to the evidence used for the main claim that states weight loss surgeries are harmful. The evidence was given from Dr. David Blum, who conducted a survey with 16,000 Medicare patients. The results stated that people 35 to 44 found that death rates more than 5% in males and nearly 3% in females. Death rates, to no surprise, went up with age, and patients 65 to 74, nearly 13% death rates in men and 6% in women. Patients 75 and older, half of men and 40% of women died. This survey fails to act as evidence for several reasons. The first is the survey neglects outside problems. A longer person lives with the stress of obesity on their bodies, the more likely their bodies develop further conditions that weaken their physical state, such as type 2 diabetes, heart disease, high blood pressure, high cholesterol, and cancer. The risk of obtaining diabetes drastically increases with a body mass index of 30 and up, especially with older people. National surveys show that 2 out of 1,000 normal weight people have diabetes, while 18.3 out of every 1,000 have obese people have diabetes, while the majority of the population for obese people has been undiagnosed. As with weight, age is another factor that increases diabetes. Percentages increase 13% because of age in the national average of people over 60. Complications with weight loss surgeries include bleeding, abscess and infection, pulmonary embolism, which is a blood clotting that gets stuck in the lungs or a blood vein, and severe nausea and vomiting. While the most common cause of death is pulmonary emboli, respiratory and infection. The evidence used suggests that death is prominent and increases significantly with age. Yet the information about obese people show that other conditions such as diabetes, joint problems, and lung strain affect such statistics. Infections are frequently more dangerous in someone who has diabetes because the body's normal ability to fight infections is impaired. To compound the problem, infections may worsen glucose control, which further delays recovery from infection. This information strengthens the argument that a diabetic's impairment of infection and the ability to clot is the main reason why death occurs in weight loss surgeries, and again backs up why death occurs more in older patients because diabetes also increases. Diabetes is a key factor that has been neglected from the survey that supports my opponent's main claim, and the weight loss surgery is harmful. Well, in fact, deaths are caused by patients' complications of being obese. The final common reason why death occurs is respiratory problems. With the years of strain on obese lungs, it is difficult to clear pulmonary embolism and maintain normal breathing patterns. The second reason why the survey fails to act as evidence is conducted in 1997 and 2002, which is almost 8 years ago when the doctors renewed such procedures and technology was inferior to today. If you're currently attempting weight loss surgery, you first have to undergo a screening to see if you're a candidate for the operation. If not, you aren't eligible. Too often people think weight loss surgery is like plastic surgery and don't actually go to a proper surgeon. If you are attempting such surgery with an inexperienced surgeon, you are severely increasing your risk for complications. Weight loss surgery may be the only way out of some symptoms for most obese people that can't lose weight by increased exercise or healthier eating habits. According to the past president of the American Society for Metabolic and Bariatric Surgery, the lap band system tends to improve or resolve diabetes 50 to 80% of the time. Therefore, the information provided by my opponent doesn't validate the main claim that weight loss surgery is a harmful way to lose weight. The survey supporting my advocate's main claim didn't take into account complications from weight loss surgeries are more often caused by diabetes and other conditions related to being obese, as well as the inexperience from new surgeons rather than weight loss surgery itself.
All right. Basically, it comes down to two things that you're presenting here as your response. One is that there are countercausalities that the study didn't account for, and there are problems with that particular study. And the other is that we could substantially address those problems if people had the surgery in the first place. So it's kind of this interesting catch-22 situation where you need, in order to get the benefits, you have to accept some of the risks that are going on. You do a pretty good job minimizing those risks, talking about how they're primarily because of the underlying issues that people face, not because of the surgery itself. I think one of the things that you might want to develop here is some information about how the technology has changed and how the teaching and success levels have changed since the original survey information from '97 and 2002. Since we're 7 years past that most recent date, there's probably a lot more contemporary information. Any current information would kind of trump that position. But I thought you did a very nice job right at the end summarizing the whole point that you were trying to make. All right, thank you. Casey?